Hi guys, Dr. Sandra Lee here. You guys also know me as Dr. Pimple Popper. I'm here to talk about one of my favorite procedures here in the office. It's called the Lunchtime Buff Shine. It's a great procedure for people who are working, who don't have time for downtime, but they want help with their brown spots, with their fine lines and wrinkles, with even acne scars. I'd like to introduce one of our physician assistants here at Skin Physicians and Surgeons. Her name is Erin Jensen. She's been with us for a very long time. You'll see Erin performing the Lunchtime Buff Shine, and she's going to tell you all about the procedure. Hopefully this video will help you to make a decision whether this procedure is right for you, and you'll learn about what kind of medical professional to seek out to have a treatment like this.
Hi, my name is Erin Jensen. I'm a physician assistant here at Skin Physicians and Surgeons. Today we're going to be doing a procedure called the Lunchtime Buff Shine. The Buff Shine is a treatment that we do to help improve acne scars, brown spots, fine lines and wrinkles, and sun damage. We use it on younger patients who suffer from acne scars, middle-aged patients who are beginning to show signs of aging with fine lines and wrinkles and brown spots. We also can use it on older patients who have deeper etched-in lines and wrinkles too. The treatment itself only takes about 20 to 30 minutes to do. It's pretty quick in and out procedure. We call it a Lunchtime Buff Shine because it essentially has zero downtime. You can do it at your lunch break and go right back to your normal activities. This type of procedure usually runs about $500, but depending on what area of the country you are, it can run anywhere from $300, I'd say up to about $1,000 a treatment. The Buff Shine includes two steps. First, we buff the skin with a procedure called dermaplaning. What that does is that removes the dead skin cells from the surface of the skin, as well as peach fuzz. The second step is to shine the skin, and we do that with our Mix 2 CO2 fractionated CO2 laser. That gives us a deeper level of exfoliation, revealing smoother, more glowing skin. While this is a really straightforward procedure, you want to make sure you're seeing someone who's qualified to perform the procedure. The first step of the procedure involves a surgical blade, so you want to make sure it's in the right hands of someone. The second step is using a strong laser. So again, you want to make sure you're seeing someone in a board-certified dermatology office to perform this type of procedure. This is Megan. Today we're going to be doing the Lunchtime Buff Shine procedure on her. So Megan, I know we've talked a lot about this procedure. What got you more interested in the procedure?
I wanted to do Buff Shine because it seems really straightforward and easy. I like the idea that there's not much downtime. I really like how my skin feels after a buff, and using the Mix 2 laser is actually not as painful as it sounds, or it's actually pretty painless, and it's very quick. What happens is that after I do a Buff and Shine, my makeup sits better. It sits more evenly. I don't have to use as much makeup, and also my product, like my moisturizers, seems to be absorbed into my skin easier because it doesn't have to fight through that layer of dead skin.
You can do this procedure up to monthly if you wanted to for maintenance, but even a few times a year is great too. The procedure is really nice if you want to do it right before a big event like a wedding or a birthday, because it really just smooths everything out and you don't have that downtime. The first step we're going to do is that we're going to degrease the face. We're going to use a little alcohol solution to take all of the makeup, excess oil off the skin. The next step we're going to do is that we're going to blade the skin. So this is a surgical blade. We're going to brush it along the skin to remove that dead skin, peach fuzz. You can essentially think about it like getting a straight shave like a man would do at a barber shop, but it's just taking off all that deeper layer of dead skin. So you can see all the little peach fuzz coming off. And you'll see when I wipe off the blade, you'll see some dead skin on the gauze too. A lot of women will ask, if I shave this hair off, is it gonna grow back thicker and darker? And the answer is no. There's different types of hair on the body. The hair on the face is called vellus hair. It will just grow back again like normal peach fuzz. It's not like hair in the armpits or on the legs that feels coarser when you shave it off. So the reason that we remove all this peach fuzz and dead skin before we do the actual laser treatment is that if you think about it, if the laser is on this lighter setting, it's going to get caught in all this hair. It's not going to penetrate down deeper into the skin. So it's essentially doing a few layers of exfoliation. So you can even do this procedure just like that, and we can just end it with just the blading. And it's nice because your makeup will rub in better, products will absorb better. So after we buff the skin, we're going to apply a layer of numbing cream. The laser treatment has very little pain to it, but some patients like to be as pain-free as possible. So you can always opt into the numbing cream or opt out if you want to. All right, we're about to get started. Andrea here is going to help us with the procedure. She's going to use a vacuum to suck up any dead skin particles that are going to come off during the laser treatment. We're going to wear some fun looking gear, some fun masks and goggles just to keep us protected. All right, let's get started. Okay, count of 3. 1, 2, 3. How's that?
Fun.
Easy, right?
Really,
Okay, here we go. On a scale of 1 to 10, how painful do you think it is?
Like a 3, maybe. It just feels like a little needle.
But quick, right?
Yeah.
Not too bad. If there's areas the patient's really concerned with, we can go over the laser a few times on that area, focus on a darker brown spot, a deeper scar, things like that. Now that we're done with the procedure, you can, if you look up close, you can see these fine, tiny little white dots. That's where the laser has treated the skin. Those little fine dots are going to turn into fine, tiny little scabs, and they will exfoliate and they'll fall off in the next few days. It's something that's really not noticeable to other people unless you look up really up close or look in a magnified mirror. The patient can easily cover it with makeup, go back to work right after this. You can see she's a little bit pink from the laser, but that's going to go away in about an hour or so, and she's more than welcome to put on makeup right now.